beautiful nurses, welcome back to my channel. This is RN Sakshi, and today we are going to discuss about the NCLEX question of the day. So without wasting any time, let's get started, and I hope you will learn something new, that how to practice questions every day, so with your critical thinkings and with the concepts. So let's get started. Okay, so question says an 84-year-old male has been losing mobility and gaining weight over the last 2 months. The patient also has the heater running in his house 24 hours a day, even on warm days. Which of the following test is most likely to be performed? So 84-year-old. So highlight the important keywords that question depicts. So ignore the age, right? So we have to just we have to keep the concept in our mind that what the question is asking. So age, not age doesn't work every time in the question. So we have to predict that what question is asking right now, right? So 84-year-old male has been losing mobility. These are the chief complaints and signs and symptoms of a patient. Losing mobility, highlight that one. And gaining weight over the last 2 months, highlight this thing as well. Then moving forward, patient also has the heater running in the house 24 hours a day. Heater means that he feels chilly, he feels very cold, right? So heater is running 24 hours a day. Which of the following test is most likely to be performed? So this is not SATA, it's only this, you have to only pick one question, one answer, right? So most likely to be performed, right? So let's get on to the options. So first is full blood count, right? That's your complete blood count, which is your CBC. So, or maybe we can think of that okay, that full blood counts can be done, like if he's feeling, if he's losing mobility and gaining weight. Sometimes it's necessary to check all the the hemoglobin, the platelets and all, but just okay, we can just keep it aside, right? Just mark this down for now. Electrocardiogram, ECG. Does the question says anywhere that patient is having problem with heart, or maybe he's having heart palpitations, right? Or irregular rhythm, missed heartbeat or something? No, right? There is no chief complaint of cardiologic, right? So there is nothing about the heart, right? So why we will choose, or we will focus on the ECG, right? So eliminate ECG, right? So focus on the elimination method. Like straight away we can cancel ECG, right? Because it doesn't say anything about heart or any chest pain or any symptom like that. Then we have CT scan, right? So just think about that. Like is the question saying that like it needs to be performed anywhere? So ECG is eliminated. Second option is eliminated. Then third option we have CT scan. So do you think that CT scan, we need any imaging test on this one? That if it's they say that like if he's gaining weight or losing mobility and only the heater is just running 24 hours a day, like we don't need to do any CT scan. There is no bone fracture or nothing about that needs to be done for imaging test, right? So CT scan can also be eliminated because we are not focusing on that one right now. So the options which are left is your full blood count and your thyroid function test. Now if you're a competent nurse, I'm pretty much sure that most of the nurses are thinking about the last option, and yes, you are correct about the last option. Why? Because see, losing mobility and gaining weight, right? Gaining and losing weight are more correlated with your hyper and hypothyroidism, because in hypothyroidism there is metabolism is decreased. So that's why the patients who are diagnosed with hypothyroidism, they gain weight, right? And with hyperthyroidism, because of their condition, they just lose weight very fast because their metabolic activity is increased. Similarly, the question was saying that he is running, like he's always having his heater on 24 hours a day, right? So maybe he's feeling very cold, right? So because hyperthyroidism patients feel very hot, right? And hypothyroidism patients always feel chilly, right? So this can be a case. So that's why between full blood count and thyroid function test, we will pick thyroid function test, because that's straight away depicting that something is wrong with their thyroid level, right? So that's how we do the elimination method. That was pretty much easier question, I know, but I just want to give a basic idea that how you have to read the question, how you have to use the elimination method, right? With the elimination method, I think you can crack almost your 90% of questions, right, if you do everyday practice, right? So yeah, so this was all about your elimination method, or doing the questions step by step. Just read every option, just do the like keep in head that okay, this can be kept aside, and just read whole options, read all options. Don't just some students, what they do, they just okay, this is the correct answer, but no, that's not like it's not. This is the image which will be in your mind when you will be studying for your endocrine system. Whenever you are studying hypo and hyperthyroidism, you can see that in the hypothyroidism picture, that how the lady is feeling so chilly, right? And how the hyperthyroidism patient is having fan in front of her because she's feeling very hot, right? So you can see there's hair loss, right? Apathy, lethargy, dry skin, muscle aches, constipation, menstrual disturbances, right? And anorexia as well. Like you can read every symptom on this one, so right? So that's why these small pictures based on the concepts can give you a highlight that yes, I have seen that woman, she was feeling chilly, so she was a hypothyroidism patient, right? So there are some concepts, like if you have already studied endocrine system, I'm sure that each and every nurse like if they're seeing this video, they will pick the answer just right away, right? But still, I'm just telling you, like, read all options. Don't just go on straight you should not move like straight away to the answer. If even if still you have a gut feeling, but still just read all options, because sometimes there is a trick behind every question. So yeah, that was all about today's video. I will be making more one with other questions as well, so stay tuned. Thank you for watching.